Okay, we're going to go ahead and get started. And today's topic for discussion is going to be functional vision evaluation. And we are going to have myself and Dr. Kelly Lusk talking on this topic. Kelly, if you want to introduce yourself, I know you've been here, but you hadn't presented yet.
Yeah, hi everybody. Kelly Lusk, Director of Program Services out at the Cloverdale Center for the Blind and Visually Impaired. I'm also a teacher of students with visual impairments, or TVI. You'll hear that referred to as all kinds of things, especially in schools. We get called vision teacher, vision specialist, which we don't really like. But yeah, so we get called a lot of different things. TVI is kind of the standard. I'm also a clinical affiliate there at Children's in Cincinnati, and volunteer assistant professor in UC, University of Cincinnati ophthalmology.
Then I'm Elsie. I'm an OT at Cincinnati Children's. I've talked to you guys a bit already. But for today, our goals for this session is we know that not everybody here will be necessarily completing CVI specific evaluations, but just letting you guys know a little bit more information on the different team roles there are within caring, like from the medical and education side of a child with CVI. We're going to describe available assessments of functional vision for educational and clinical use. Again, you guys may not be doing these yourselves, but there's things that are good insights for you to understand for patients that you see or children that you see who may be getting these services, or even pulling some of this knowledge into your own clinical care. And then we're also going to identify approaches to observe and assess visual behaviors or CVI characteristics. So today is our last session that's more CVI background evaluation focused. And then starting next week, we're going to have more on intervention as we go through our kind of curriculum. So Kelly, you can go ahead.
Yeah, absolutely. So I know last week during the case, there were a couple topics that came up that I thought, oh, this is great. This is a great segue into this week's presentation because, they were talking about a vision professional TVI, somebody coming out to observe and assess a child. And so I thought that way, if I can just tell you guys a little bit more about what the vision professionals do, the TVIs, that then also, even if you're not giving these assessments or evaluations, you might know what to ask for. So a lot of times they're not necessarily going to share with you some of these assessments that we're going to talk about in a minute. So you might, just be prompted to say, hey, do you happen to have done this particular evaluation? Could I possibly get a copy of that report so that I can, review that information, see how it might impact? Because there is a lot of crossover, and we're going to be talking about that a lot today. So the care team, typically you're going to have some sort of eye care provider, either an ophthalmologist or an optometrist, hopefully an ophthalmic tech. A lot of times we call these providers, the ophthalmologist and optometrist, the low vision specialists, because they've been trained to specifically work with kids who have severe ocular or brain-based visual impairments. The teacher students with visual impairments is good to have on your care team, just so you do have that educational side of things to balance out with all the medical clinical stuff. An orientation mobility specialist, so that's someone that specializes specifically in traveling and mobility and how to do it safely and efficiently and effectively. Your allied health professionals, OTs are on, I think, all of our teams. You may also have PT and speech involved, depending on the type of clinic you're running. We always want to include the parents and the guardians. Of course, they know their kids better than anyone else and always have important information to contribute. And then any of the child's education team members. So if they have a TVI, if they have an OT, if they have a paraprofessional that works with them on a daily basis, those people can also oftentimes contribute nuggets of information that may be extremely important to, kind of the overall objectives for the clinic visit or the evaluation process. And a lot of times I think we kind of tend to, especially in a clinic setting, maybe not, I don't want to say discount those people, but sometimes it's just not really thought about that we might want to pull those people in. And it tends to be kind of an isolated, we just look at what's happening the day of the evaluation or the clinic visit. And sometimes adding in that extra information can really be helpful for how's this going to actually translate out into the real world where this kid's in school or going to a center or whatever every single day. There is a little YouTube video there. We don't need to watch it right now, I don't think, Elsie, but it's an example of how we run our interdisciplinary low vision and CVI clinics where everyone is actually in the room all at the same time. So there are different types. A lot of places it's multidisciplinary where you might see different people kind of in different areas, and then they all get together and chat about it later. But ours, we actually try to do as interdisciplinary as possible, where we are literally all together in the same space so that we can all be hearing kind of what everybody else is doing. And sometimes it gets a little loud and a little crazy. But we do find that we all learn from each other and learn from what each of us is doing. So go to the next slide. Okay. All right. And the next one. So I just have some acronyms and definitions here. Again, what we found at Cincinnati Children's is that a lot of our OTs and other allied health professionals may not have, they're in a clinical or center environment. They may not have worked in a school environment. So a lot of times these acronyms may not be something they're familiar with. So I always share them in presentations. Please don't be offended if you're fully comfortable with these. Of course, IEP is the individualized education plan or program for ages 3 to 21. Before that, if they're in early intervention, they'd have an individualized family service plan, hopefully for 0 to 3, or an IFSP. Within our vision specific language, we have the expanded core curriculum for students with visual impairments and multiple disabilities, often referred to just as the ECC, and I'm going to go into that in a lot more detail here in a bit. The teacher of students with visual impairments that I already referenced. O&M is orientation and mobility, and then you may just hear someone referred to as the O&M specialist, but if they are a certified orientation mobility specialist by our certifying body, they would be a COMS. So you'll see that COMS as well as maybe just O&M specialist or O&M instructor. So you can refer back to those later if you pull these slides, but just so when you're going, what are all these alphabet soup? So some school district essential assessments related to visual impairment that I just, again, wanted to point out to you so that you'll kind of have an idea of the types of things that if a child has been diagnosed with a vision impairment and is receiving services or is they're looking at eligibility for special ed, these are some of the assessments that the TVI or the orientation mobility specialist would be completing on them. And then sometimes you're also going to see these done potentially within the clinic setting. So that first one, the CVI range or assessment, may be an outside eval. Our OTs at Cincinnati Children's have been trained in doing those and complete those a lot of times on our kids. Again, it's done in the clinic setting, so it is going to be different than if it had been completed in the educational setting, because we know that all of the environment is very different in a clinic setting versus the real world setting. But Elsie's going to go into a lot more detail about that one later. The functional vision assessment and then there's also a learning media assessment that can be combined with it. It's actually a published assessment that we give to kids. I'll talk about that here in a little bit. There's also a Perkins School for the Blind has a new CVI protocol that I'll go into a little detail about. Then there's a learning media assessment or LMA. There are assessments for the expanded core areas, which I'm going to tell you about in a little bit. There's orientation mobility assessments that would be done by the O&M specialist, and then reading inventories. So I guess let's go ahead and go, Elsie. So this is not an exhaustive list. Those are kind of the main ones. There are obviously some other ones. A lot of times there's psychological testing, academic testing that's done, especially like Oregon or Battelle or whatever with younger kids, so that we can kind of get an idea of developmentally where they're at in all their areas, because we know vision can impact literally every area there is. So a little bit more about these, just so you're aware of what's involved in each one of them. And again, what areas you might want to hear more about. The functional vision assessment that we do, there's a little picture of it there from American Printing House for the Blind. This is just one of them. There's a couple of different ones out there, but this is the one I prefer. It just looks at how the child is using their functional vision in the entire educational environment. And the reason I say this is really important, especially for allied health professionals, is it doesn't just look at your academic learning. It doesn't just look at, can they see the board? Can they read their textbooks? We go and we evaluate them in the gym, in the cafeteria, getting on and off the bus, all around the school campus. So, how do they do inside, outside, on the playground? We look at all of those different areas. So that's when we start pulling in, hey, they might need to be referred to OT or PT because we're seeing some things happening in these other areas that may or may not be related to vision. But we just definitely look at them in all those areas because it's not just about the academic side. This one is the primary instrument we use to determine educational eligibility because, again, most of our kids, if they have a diagnosis, they're going to meet that medical eligibility, especially in CBI. But we do in most states have to show an educational impact. So this is the primary instrument that we use to say, hey, yes, we are seeing that the vision impairment is impacting their educational ability to do the things they need to do in the school setting. And that's why they need to be certified eligible for special education and an IEP. The learning media assessment, again, this one is a combined assessment, but it looks at the learning channels and what's going to be the best literacy and learning media option for the child now and in the future. So we do look at kind of, how are they doing now, but where might they end up? We look at the visual channels to see if they're going to be more of a print reader, tactile, if they're more of a braille reader. Are they using auditory channels? We definitely want that to, if at all possible, be an adjunct to text-based literacy. We want them to have a text-based literacy medium, just because we know that when we switch to more auditory or start using, relying more on auditory, we're losing those spelling, punctuation, capitalization, things like that. We do have kids that can be dual media where they're using both print and braille. Even some of our CBI kids are both print and braille, although it's not necessarily something that we see a lot with CBI kids. But primarily what we want to remember with all of this is that we should be revisiting and reassessing this frequently because it can change. We have a kid that is, doing really well with print when they're younger. And then it may be that as they get older, we have to do some things differently and maybe add in more auditory or something like that. All right, next slide. The Perkins CBI protocol was developed just recently. And so I just literally took a blurb from their website that's an expert evaluation tool designed to help teachers of the visually impaired create a robust, individualized CBI evaluation report with recommendations for students with CBI. So we kind of see this one as the functional vision assessment LMA that I was just talking about. We use that with all of our kids with a vision impairment. However, this protocol is specific for CBI. So a lot of the things in the regular FVA LMA, it doesn't really go deep enough, it seems like, for a lot of our CBI kids. So this one is really neat because it actually can help determine if there's a referral, if we don't know if there's a diagnosis yet. And it just really kind of gets more into the nuts and bolts of specifically kids with CBI and how their vision impacts their learning. So it's a really good one now to use, as well as the regular FVA LMA that we use with all of our kids with vision impairments, to really dig a little bit deeper and get even more at specifically, recommendations based on the CBI diagnosis. And as we mentioned in the first session, we do routinely see kids with both an ocular visual impairment and CBI. So a lot of times we still need to do both assessments because, everything is impacted from all these different angles. All right, next slide. So the expanded core curriculum and O&M assessments. O&M is one of the areas of the expanded core, and I have those listed, I think, on one of my next slides. So we'll go into those areas as well. But these are 9 areas that may need to be explicitly taught. So most kids learn a lot of things. We call it incidental visual observation. So kids watch their parents, they watch their peers, they watch their teachers, they learn how to do things by visually observing how other people do it. And then they replicate kind of what they've seen others do. We see little tiny children doing this with, helping mom around the house and doing things, going to the store and pushing their little shopping carts and things like that. So there's a lot of that that is missed sometimes with kids that have CVI or other visual impairments. So we may need to really get in there, and that's where the IEP comes in, or the IFSP, to make sure that we are appropriately addressing these skills at each stage. Again, developmentally appropriate. We're not going to be doing the same type of career ed with preschoolers that we would do with high schoolers, but there's always a way to address each one at each stage of development. Again, it's the primary assessment for determining IEP goals. So we use the FB LMA, functional vision and learning media assessment, to determine eligibility. And then the ECC assessment is really the one that digs deep into what goals do we need to actually address this school year. What are the specific things that we need to be working on a weekly or monthly basis. There is a lot of overlap with other areas. So like I mentioned before, if we are out on the playground with a kid or going through the lunch line or getting on the bus and we're seeing something that we don't know how much of it is vision and how much of it may be other developmental areas, There are lots of opportunities to co-teach or co-treat with the O&M specialist, the occupational therapist, physical therapist, speech language pathologist. So the difference is why. So again, is the issue due to the vision, or are there other things happening, or both? Again, a lot of times it's both. And so, if we're addressing, why they are having trouble making a peanut butter sandwich, is it because they can't see the bread and the peanut butter and the knife and how they're, visually putting the peanut butter on the bread? Or is it because physically, they're having trouble manipulating the knife and holding the bread properly and, things like that. So I think, a lot of times we end up co-teaching, co-treating, especially in the school setting, so that we can address those from different perspectives, and also in our clinic setting. Orientation mobility, like I mentioned, safe, efficient, and effective travel. We want our students to be independent to the level that is possible and developmentally appropriate. Obviously, a 3 or 4 year old is not going to be crossing streets by themselves, but we do want them to be, potentially starting to understand even concepts like body awareness and body position, left, right, up, down, under, over. Those are the types of things that are going to someday contribute to being an independent traveler and being able to follow, directions and things. All right. Reading inventories. We do a lot of reading inventories. Again, so much of what we do with kids with vision impairments, even with CVI, is literacy based. In between the formal assessments, monthly or quarterly at least, we want to be checking on that. It's a great way to track progress and check for regression, especially after school breaks and things. Often it's the first red flag for referral for possible reading or learning disabilities. And it's extremely important to make sure this transition is ready to happen, typically between 2nd and 3rd grade. We say that kids move from learning to read to reading to learn. So instead of learning about the building blocks of reading, they're moving to using all the reading skills they've learned to actually start doing everything else, science, math, social studies, literature, digging deeper into those types of skills. And if we haven't gotten the literacy skills cemented prior to that transition time, that's when we really start to see major issues moving forward. And especially for our kids with CVI, the reading inventories can help us determine if they need more spacing, if they need line guides, if they need to be blocking out certain chunks of text, so that we can isolate just the line they're reading on. There's all kinds of things that we can look at when doing a reading inventory to determine how we can just help them be successful at reading and increase those literacy skills at the appropriate rate. Because if it gets out of hand and we're late, then it's really hard to backtrack and get them back on track. They just tend to get further and further behind. So those ECC areas that I mentioned, we have compensatory skills, which includes the reading media. So that would include your Braille or your print. Orientation mobility, we already mentioned. Sensory efficiency, so that's all of the senses. That's basically making sure that we're using multisensory approaches to things, that we're looking at not just the visual sense, if they have vision, but hearing and touch and even smell and taste. How can we make sure that everything we're doing is that they are using their senses efficiently? Assistive technology, there are obviously assistive technologies that all kids use, laptops and iPads and tablets and everything, but we also have a lot of low vision or vision specific assistive technology for magnification. Again, things that can block out text, things that can read to you on top of the visual text or whatever. Just lots of different options there. So that's definitely an area that we want to assess and be keeping up with for all of our kids. Recreation and leisure is basically the work-life balance piece of all of this. Independent living skills. I know all of you that are OTs and PTs, you do a lot of that as well. Again, maybe from a different perspective of the physical side of things, whereas we're looking at it from the vision side. Career education is obviously one that impacts our kids quite a bit, just due to the fact that not having vision is going to impact how you do your job and the accommodations that you need. And the social interaction skills. If you've ever been around a person who's blind or low vision or has CVI, they obviously may not be able to see social cues. They may not be able to see, again, how other people observe the situation and make changes to their demeanor and how they are talking to you based on how you're looking at them. If you're looking at them like they're crazy, or you have a really quizzical expression on your face, your kids with CVI are not necessarily going to have that face recognition where they're going to understand what your face means. So they may not realize that you have no clue what's going on and they need to clarify. And then self-determination is all about self-advocacy and confidence and just being able to make decisions that are going to impact their life, going forward. So I'm going to talk about each one of these a little bit more in depth. And what I want you to think about while we're doing that is think about every stage of school and life development. So from preschool on to high school and even beyond, every single one of these is applicable at each of those times. So compensatory skills, that's to access the core curriculum, all of your communication skills, study skills, organization. So obviously, we're starting those even with pre-reading and pre-math and, all of those types of things. Even just putting your stuff back where it came from, putting stuff in your cubby, even in the preschool area, those are important skills that again can be totally impacted by vision, because you do need to keep your things where they go and in an organized fashion if you have a vision impairment, because you can't very quickly just glance through your crazy closet or your crazy office or whatever, if it's not as easy to do that kind of stuff visually and find things. Orientation mobility, I know we've mentioned a bunch, but yeah, the body image and body awareness, positional concepts, we do a lot of that with our young kids. And people will sometimes say, why are you worrying about orientation mobility with a 3-year-old? And it's like there's a lot of skills before they would potentially, be using a cane or be doing a lot of independent travel, that they still need to be learning all of those concepts prior to doing it, independently. We talked about the functional vision and sensory efficiency, knowing that information exists. So a lot of times our kids with CVI are going to have issues with their distance vision. So if they don't know that there's something out there to be seen or to be accessed, then they're not going to look for it. So I know that I had a call just the other day from a PT, and she was asking about object permanence in kids with vision impairment and walking and moving. And, I said, yeah, that can obviously impact. I mean, obviously our kids don't have to have, all of those skills together to be walking or whatever, but it does help. If you know that there's something out there you want to get to, that's going to be more motivating to you to move towards it. If you can't see it and have no clue that it exists out there, a toy or a bottle or whatever it is, you're possibly not going to have that motivation to use those other developmental areas and skills to move towards it. Same thing with speech. If you don't know that there's a bottle over there, you have no motivation to say bottle or I want that or whatever, or sign even. Using efficient search techniques without devices, and without devices, I mean without magnification of some sort. So if you drop something or that something is there, but you can't find it, you have to have efficient ways to search for things non-visually. And then knowing when to use and using optical devices and other assistive technologies. So again, you've got to know things are out there, and hey, I might need to use some magnification or other technologies to find that information. I think I already mentioned assistive technology, so we can kind of bounce through that one. Rec and leisure skills, again, very, very incidentally learned by other kids. We really don't think about how much we learn how to do so many things by just watching kind of other people do it. Sports are one, and again, we just watch sports, right? There's a lot of things that we do visually to relax, to take our mind off other things. And so these things just have to be done very differently by kids with CVI. Leisure activities, we think about, I know that knitting and crocheting have become big things lately, and you can do those if you're blind and visually impaired. It's a very tactile activity, but it's still, a lot of times there has to be a lot of kind of pre-teaching that happens before, because you can't just kind of watch a YouTube video on it and learn how to do it. But it's very, very important, again, for a work-life balance for our kids to have those recreation and leisure opportunities. Traditionally, in our field of vision and education, we have worked so hard to make sure our kids are successful academically that sometimes this kind of gets lost in the shuffle. And we have kids that have masters and PhDs, but they don't know how to relax. They don't know how to do fun social activities with friends, because it was so focused on, can they read? Can they access the textbooks? Can they see the information on the chalkboard? And we kind of left out the what about the rest of your life when, everybody else is doing cool stuff and you're like, I don't know how to do anything except be a student. um, Again, this all comes back into independent living skills, mostly learned incidentally. I know I've got this little bullet point on like half of these because it's so important, and we just have to keep reminding ourselves that so much is missed when you don't have that incidental visual observation. And especially for kids with CVI, when there's so much clutter in the environment, there's so much going on, a lot of times they tend to kind of just shut down and they're not picking up on all those things that are happening around them. But it's like money management. All of our bills in the US are the same size. They all feel exactly the same. There's no way to tell them apart. So you have to either have something that, tells you, reads it for you, a technology device, or you have to learn how to fold your money in different ways so that you know that the one folded this way is a 1 or a 5 or a 10 or a 20. Personal hygiene and grooming. Again, we learn a lot of that incidentally by watching other people. We watch makeup videos. We watch all kinds of stuff. How do you floss your teeth if you've never seen somebody floss their teeth, And then household chores and food preparation. Again, we always are having these conversations with our OTs, with our kids, but coming at it from the low vision or CVI standpoint, it just kind of throws another wrench into the works. Career education. I always get asked on this one, why would you do career education with young kids? Okay, we have community helpers come in. We have firemen, policemen come in. If you're visually impaired or have CVI, you might not be able to see the red fire truck, or you might be able to see that it's red, but not understand, how it's different from any other red vehicle out there. So, there's just lots of different skills and information that needs to be explicitly taught, perhaps. And it's not even that the child might be even eligible for that career, probably not going to have a blind firefighter, blind fighter pilot, but they still need to be aware that those careers exist. They need, they have the right, just like everybody else, to, even if it's not something they're going to go into, to know what those things are about. And a lot of times it's just kind of glossed over because they don't see it, they can't observe it the same way their peers do. Okay. Social interaction skills. There's a lot of nonverbal communication skills that happen. Just like we mentioned, if I'm sitting here on the call and I've got my arms crossed and I'm leaning back and I'm like, oh my goodness, or I'm rolling my eyes, I'm not engaged. I'm not enjoying this. Hopefully none of you are doing that right now. But you're going to change what you're doing based on if the people in the room with you are like backing away from you. Personal space is an issue. A lot of times people that are visually impaired will get up on you a little bit closer. And again, it's just because they can't see you and they're trying to make sure that they're, getting all the information. And they don't realize necessarily that they are a little too close and it's maybe a little uncomfortable. And then just, going out to the movies and stuff and doing different, going out to restaurants and things. There are so many nonverbal communication skills that just get lost in the shuffle. So we do a lot of pre-teaching and co-teaching and just explicit instruction on what are those things and why are they important and why is it important not to be right up in somebody's face when you're talking to them. But if you've never observed how far apart people stand when they talk, you don't know that that's not what everybody else is doing. So last one, self-determination. It's about self-concept, self-worth, self-advocacy, independence, confidence, ambition. It's just all about knowing that even though you have you're blind or have a visual impairment, CVI, that you can do things, maybe just not in the same way as your peers, but you can still do them, and you can definitely still be very successful, very independent. And that's our whole goal as TVIs, is to work ourselves out of a job by the time the child is ready to move on to post-secondary options. So I think that's all for me. Elsie, take it away.
Yeah, thanks, Kelly, so much. I think, like I said at the beginning, I'm an OT, but I think learning what TVIs do is really intriguing, and it's really amazing, like the wealth of knowledge that we can get from you guys. So I think a lot of us here, we're in outpatient or even in early intervention. I think whenever possible, I always like to try to get releases from families to be able to talk with a child's TVI, to get their perspectives on how I can best support a child in their clinical services. So I do advocate, like, for all you guys, if you do have any patients who are in school age, who do have that connected service, to do it. And I think also Sometimes families, even if they have a diagnosis, they don't realize they can push for services. So I think it's
Right.
so important to get families connected. So I'm glad that you were able to
Yeah, the
work
feeling's
out of your
mutual. We
scope,
we learn
Kelly.
so much from you guys too. I think we're such a low incidence population though that I feel like so many people don't even realize TVIs exist half the time until their child or they have a student with a vision impairment and they go, "There's a whole field for this. This is a certification area." And so yeah, I think just we all have to work together. It's always a village. So
Yeah. Well, I'll finish us off with more of like a clinical focused approaches towards observing CVI and taking that to kind of put together observations that you can use to support whatever work you guys are doing. So this isn't an exhaustive list of all the things I would do in an evaluation, but I think it's the more of those practical things that I think anyone here would be able to implement in the services you guys are doing. So let's see. So in general, my general approach, and I think the general approach of anyone here when you're working with a child is we want to identify a child's strengths and preferences. And in the context of CVI and working with a child with CVI, or you suspect it, thinking about where does this child perform best with looking or attention or engagement with an activity? And do they have any specific preferences that kind of help support their engagement? But we also want to work and identify any potential participation barriers. When we're thinking about CVI, that could be anything from how the environment is with a busy environment or a bright room versus a dim room or what toy we're showing. Those are some different barriers that can impact how a child is engaging in an activity, whether it's a day-to-day task or a therapy task. So in my mind, when I think about talking through approaches for evaluation and assessment, is thinking about identifying those strengths and preferences and identifying those barriers, and then taking that information to see how are those things overall impacting achieving their goals or learning new skills that you guys are working on them with. And one thing that I typically will start with is some of that more specific caregiver interview. As Kelly had mentioned, caregivers can provide a lot of insight for how their child is functioning day to day and how they use their vision. They may not realize that these are vision specific things, but they can be pretty attuned to their child's performance. And that Perkins protocol that Kelly had shared, which I'm going to put in the resources for today, they have a really great list of things that we can kind of guide some questions potentially that will look at different areas of CVI and how a child's performing. And I've just pulled a few that I tend to ask more often than not for kids with CVI as like just a way for you guys can kind of start building your idea of, I have a child who I'm concerned about CVI or that does have CVI. These are some starting questions that you guys can do to start gathering information about those strengths, those preferences, or those barriers. So exploring visual preferences, you may want to ask about what objects and what characteristics of a toy maybe helps attract their focus or keep their attention longer. Or is there a specific environment that either supports or hurts their attention or engagement in an activity? When we think about visual performance, we may want to ask questions about are we consistent with how we look and how we're able to focus on a task? Do we have kind of fatigue and does our vision use vary? Again, pulling into environments. Do we do well in new environments or are we do we have a hard time with new environments? We can ask about, how many objects can we focus on at a single time? If there's more clutter in the environment, does that change how we're able to focus? And then two other areas I feel like questions tend to kind of get grouped into is maybe that social communication area of CVI and just overall task participation. So for kids with CVI, as Kelly was talking about some of those communication and social aspects, often it could be helpful to ask, do you think your child visually recognizes a family member? Or are they maybe using the sound of someone's voice to recognize who they are? Or do they make eye contact or look towards someone? Are they able to kind of focus on a face in general versus some kids can focus on a toy, but a person's face is pretty complex and it may not be as visually motivating. You can see if people are able to understand facial expressions. Can they see that those minor movements of how our face muscles are contracting? Can they look at that and know that that means a happy face for a sad face? For kids with CBI, that could be tricky and that can cause some social challenges. And then thinking about task participation, just figuring out what level of assistance do children need to participate in everyday activities, whether it's gross motor skills, daily living skills, and seeing, are there certain things that seem to be more challenged due to vision versus maybe a motor component of that task. Another thing that I often ask related to task participation is, are we able to use our hands and eyes together? Kids with CBI, they may have a hard time having their brain work with two different components. It may just be, I need to look, or I need to move my body, move my arms, move my legs. Using both of those in tandem may be challenging. You can ask about, ability to explore their environments. Are they using more of their other sensory systems to explore, which is a great strength if they are able to kind of tap into other areas. But it may show that we may have weaker vision if we are using our hearing or sense of touch to explore more. So again, these aren't an exhaustive list, just some starting probing questions you can use, but I do think that Perkins protocol has some really cool options in terms of diving into different areas of visual performance. And so shifting from questions, I think it's just really important to watch a child and see about making different observations of how they're interacting with the activity that you're showing them, the toys, their environment. Because what we can do is when we're observing them, we can see if there are those things that they respond better to, things that they have a harder time interacting with, or if there's just different like marked responses based off different activities. So these, I'm not going to go directly into every single one of these areas on the screen, but I do feel like these tend to be a lot of things that we can observe in some kind of clinical interaction. So regardless of a child's age, we could always look at how do they react to three-dimensional materials versus two-dimensional materials. A child with CBI may have little to no regard or interest in a picture, but if they have a 2D or a 3D actual object shown to them, they may be able to react to it. A child with CBI, they may only be able to look at 2D materials if there's like one single thing on the page versus many things on a page. We'll want to kind of make observations of, do things change with our engagement or our visual attention or skills with the environment? So whether there's a noisy room, different lighting, cluttered versus kind of calm and not visually busy. Again, that look towards, when things are more complex, so there's more things to focus on. Does that change our participation? We can look at overall, what is their visual attention like? What is their visual response time? Does it take them long to focus onto something? Ability to visually fixate or track, or even look at things in all their visual fields. Being able to look at all these kind of visual skills within different activities and showing different materials and seeing if there's any changes with how they visually attend based off, what kind of toy do you show them or how is their environment set up can be helpful. Some of these we've already talked about. So looking at, is there any sensory compensation using more of our sense of touch or hearing to assist us in using our vision versus using vision alone? We may see kids love watching videos on an iPad, but then you realize the noise is always on the iPad. And then if you turn off the volume and there's no more noise, you may notice that they're actually not really looking at the video or the thing on the screen. They're really just motivated by the auditory component. So their visual skills towards a video may actually be more interested in the noises of it. We can look at social responses and those social interactions with others, kind of like Kelly had mentioned earlier. And then we could also, again, continue to look at how we're using our hands and eyes together in a coordinated manner. And Kelly had mentioned the CBI range above. I'm going to brush on it a little bit because it is typically it is a more widely talked tool within the CBI community and CBI field. It isn't the perfect tool. I don't think we have any perfect tool or measure for CVI quite yet. I think we're still in the early stages of like better understanding this diagnosis as a whole, and we don't have very concrete ways to measure abilities um, in CVI. So this is an available tool. It's from that educational side. Us OTs at Cincinnati Children's will complete it with families, but we are starting to try to find some additional measures that we can use either in replacement of the CVI range or alongside it, because we do realize it doesn't always measure every kind of aspect of CVI perfectly, because it is a subjective rating scale. So how the CVI range works, it's an observational. So the person who is assessing identifies activities that they'll do with the child. And based off those activities and how the child performs, you're going to rate them on these different characteristics of CVI that are identified in the scale, which will ultimately result in a CVI score, which will give you a phase. Phase 1 CVI is those lower level skills. Phase 2 is kind of intermediate abilities. And then phase 3 is your highest level, more subtle CVI challenges. So the areas in which the CVI range will look at include response to color, movement, visual latency, which is that time needed to respond to visual stimulation, how a child interacts with things in their different visual fields, right, left, up, down. There's a set of complexity categories, which looks at complexity of an object is how many colors a toy or an object may have where they can still focus on it. Complexity of array is how many things can be out at a time where they can still visually focus or locate something. Complexity sensory means if there's other competing sensory background information while they're trying to focus, can they focus visually still? So do noises distract them from using their vision? Complexity of faces looks at how they're able to look at a person and do social interactions. And then also response to lighted materials, ability to see in a distance. We look at visual reflexes of response to touch to the nose if they blink, or response to threat, where we bring the hand close to the nose real fast and seeing if they have a reaction to noticing those things approaching them. Kids with more significant CVI, they won't perceive the hand approaching the face when it is moving fast or slowly towards their face potentially, because they just don't have that visual awareness. And then also visual novelty, which is if something's familiar versus new, do we have a different reaction? And then visually guided reach, which is using that hands and eyes together. So for each of those characteristics within the CVI range, again, it's not all encompassing of all the things we may see functionally impacted by CVI. There is going to be a 0 to 1 scoring. So as you guys can see down here, here's the scoring for color. So 0 is going to be the most impacted level of CVI, whereas 1 is going to be the least impacted level of CVI. And there's going to be set kind of terminology and kind of progression of how you can rate these different areas. It's not always perfect and it doesn't always fit every kid. And that's why one of these, like using the CVI range exclusively to describe CVI function can be challenging because this may not fit every child. But like I said, when you do the CVI range, we get one of these phase scores for every child, and you're able to say kind of where does this kid's skills fall within this continuum of function. So phase 1 is where we're building those more consistent visual responses. So looking and fixation and just overall regard to images and objects. Phase 2 is where we're pairing the ability to look with an action. So we're kind of building on, we're not just looking, now we're looking and we're reaching for something. We're looking and interacting with a toy or an object. All the way up to phase 3, where the visual processing becomes more refined and it's more observing characteristics and details and having better understanding of something. And at this phase 3 part of CVI, there's more resolution and kind of working through these skills, and it may be more subtle in their presentation. So that's the CVI range. And I think that's one that's often talked about. I feel like parents are often wanting to know, like, if their kid does have CVI, they hear about the CVI range fast. And that's kind of one of the assessments they seek out. But another tool that's newer that I think from a clinical perspective is super helpful, and I've been using it in my own clinical practice, is called the Visual Behaviors Tool for CVI, or the VIBES. And it is a structured approach for identifying level of visual behaviors in a child. And similar to the CVI range and the other things we've talked about, it's observational. So I think for a lot of things with CVI, we really do have to observe and see that individualized response in a child. So what's tricky is for any observational tool, there's room for subjectivity or interpretation needed on the assessor's side. But the Vibes tool has shown good inter-rater reliability in its development, which is reassuring, I think, on my end. And essentially, with the Vibes tool, the child is offered or shown materials and then scored on a matrix for how they interact with the toy, specifically looking at visual attention, visual fixation, and motor response, and they give you a 5-point scale. So you can use this tool yourself and you choose to show the child something and you watch for their response and you get to rate them. So this is kind of small and I hope you guys can see it on your computers, but it does show the levels or the areas that you'll look at, and then the levels you can rate a child. And we'll actually practice doing this together. But I think it's a nice option because you can show a child some toy or stimulus and then rate them on the see it, the find it, and the use it criteria here. And then you can make a change to how you're presenting something. Maybe you have a lighted toy in a normally lit room and you do a score and you see where they fall on this matrix. But then maybe next you'll dim the lights in the room or turn off the lights and you do it again and see if their performance improves. From my experience doing this, you can track that change within a single like few minutes of you add an adaptation and you can see a change in performance and you can actually track that in this subjective manner, which I think is helpful to show that these visual preferences can change performance. So all the way from like a 0 level up top, that would be there's no visual awareness or no awareness to the object, going up to visual awareness level at 1. At level 2, the child is showing visual attention. At 3, the child is showing visual detection. And at 4, the child is showing visual understanding. So it does show that progression of how they're interacting. So for example, this is something I have pulled from my own documentation. So whether it's in evaluations or treatment with a child, I'll pull in like a little blurb about what the Vibes tool is and then say, for visual stimulation in a dark room, the child demonstrated the following level of interaction with a lighted toy. And then you can give their levels for the see it, find it, use it. And then say I make a change and I want to see, well, how would their response be in a lit room? I would just repeat that phrasing here and then just change the setup and then rescore it. And you can kind of see the difference in performance and function between trials. And I think it's a nice way to document that. So as a group, what I think we're going to do, and I'm not sure if I have availability of the chat, Kelly, so if you want to monitor that for us, if you guys can see it right here, we have the find it scale, which is visual fixation and visual field. And then we have a buddy here in this video, and we're just going to watch it for a little bit. And then I'm going to pause it. And if people in the chat box want to put where they think this child falls on their level for find it scale, we'll go from there. Okay, is there anything in the chat or does anyone want to offer up a level?
Yep, We're getting a couple of several ones.
Okay, yep. I think that's fair. What we're going to do is we slowly, our person in the video, they added some different visual adaptations, so we're able to continually assess how this child's level is with different objects. So
So we
now,
did have a question about, does it matter that the toy makes noise? And yes, we typically want to try not to make noise if we're really wanting to focus in on the vision. So sometimes it's a little bit unavoidable, but yeah, we would try to make sure it doesn't make noise because you want to be looking at their vision and not their hearing.
yeah,
So
good call out.
yeah, yeah.
Okay, well now let's look at, we added movement adaptation with a slinky, and let's see if we think this child still stays at a 1. Uh, my mouse is disappearing on me, guys. Sorry. Okay. If you want to put in the chat what you guys think about that one. Did it change from a 1? Is it the same? Looks like people are saying a 2.
Yeah.
So a little bit of an improvement. So we're going to continue to assess this and see if it gets any better. So I think next they're going to do, the lights are a little bit lower, and now there's a light added to the slinky. And now the lights are off. So from that, once the lights were off, what did you guys think was her level you would rate her? And sorry, my screen's going crazy on me. Okay, I see some 3s. Yeah. So I think it's cool to see we can kind of continually do this assessment of how someone's using their vision. And I think this tool I personally like because it does show those changes. And also this is kind of more of a tool that we would use for lower level kids. I think for higher level CVI kiddos, it's not maybe the best fit, but I think it is a good way to concretely track changes with these interventions we may try with them.
Yeah, and I'm not sure that I would say, in the second one that we were fully at a 2. I think she was moving towards a 2, and in this one, moving towards a 3. It's definitely improving, but and I know I feel like it seemed like we were supposed to go all the way, but I do think that there was still definitely a lot of delay. And I think there was also some possibly light gazing in the ones with the light up there. Because I don't know if you guys were noticing, she wasn't looking down at the other part of the slinky, she was looking up towards the light. And so I think there was still a lot of that, being pulled in, that she was very aware that there was a big bright light up top. So yeah, it's not as cut and dried as like definitely
Yeah.
moving all the way to 2. It's still, you're going to have some of possibly even all of them at the same time. But yeah,
Yeah.
definitely improving with the changes and addition of light. So
Okay, and I was going to have us do another one, but oh, so here I think, like I was saying at the beginning of this portion for my part, I think for functional vision evaluations from a clinical perspective, I really do think the big things is watching and observing for these specific visual characteristics. And as we're doing that, we want to identify what are those child's strengths and preferences with using their vision and identify those barriers. And that's where we're going to take those things that we observe and use those things to adapt the task that we're doing to fit the child's needs. So as we were kind of watching that video, we're seeing that we're making these small changes to see if we can support participation better with visual tracking. So I think that's just that continual process. And I think from there, what we'll do, time, we'll switch over to questions. So if anybody has any questions about either kind of like the clinical or educational evaluation piece, You can put things in the chat and then we'll shift into our case study for the rest of the session. Let's see, we have Cheryl asking, as an OT, do you use the vibes to help create goals? I haven't necessarily used it in that context yet. I've used it more just as kind of like a way to track progress, if anything, or track performance at this point in time. And then I know if I mark down what type of toy and what environment I did, and this was their level, I can track that progress over time. I think it is something you could potentially write a goal towards. So I don't think that's something that I wouldn't potentially do. I think it's definitely something you could do as an option. Like I said, I like it because it is a little bit more of a structured way to look at it. When we're thinking about how we're looking. And we didn't necessarily look at the reaching scale, but I think that's a nice one too, if you're looking at how someone's able to do a visually guided reach. And then Vicky had mentioned, would you try to get her in a better position, especially at midline with her head? Yes, I think when talking with the person who's doing this video, this was at their evaluation. So they were just trying to see how this child truly would perform with their own like unadapted positioning. And then she did change that to get a better body position.
I can speak to, I would say, yeah, only change one variable at a time just to see what the difference is. Sometimes you may want to stack, the light and the movement, but obviously we want to do as little as possible in terms of, because we want to start decreasing those prompts and those extra additions. So yeah, I would think you would try adding light or try adding movement separately, and then if neither of those is helping, then maybe do both. And as far as the toys, you can really use really anything. I mean, we try to. It's funny, we have this whole you guys at children's and the OT space have a whole room of toys. And as TVIs, we do the same thing. We have toys just of all sorts of sizes. We find them at Dollar Trees, and we used to find them all the time at Toys R Us and stuff. But if you can find, and it's very tricky, but that question earlier, it's very tricky to find toys that light up or have movement but don't make noise. So if you can find toys that do one or two of those but not the third one, the making noise one, and there's a lot of them that even will like spin or do something, but they have this whirring noise with them. So I mean, it's very tricky. But if you can find a toy that has those different components, it's really great. If the child seems to have a preferred color or a preferred type of toy that they like or that they already are familiar with, we often a lot of times will start with a more familiar toy or a preferred color, and then again try to move away from that preferred to get to more unfamiliar items, because obviously we want them to be able to look at anything. But yeah, it's totally up to you and what you have in your arsenal, and then whatever is working with that particular child. We say that there are no CVI kids that are cookie cutter kids. You can't say, oh, this works with CVI kids because it's going to work with that one CVI kid, and it's not going to work with every other CVI kid potentially. So good luck.
And then Anita had asked in the chat, do you always start with presenting the toy slowly moving and then you increase the movement, then light? I think that's a good approach. And you had asked specifically within using the vibes tool. I think in general, when you're showing kids something and doing those observations, I always like to have it like stable, not moving. And then if they can't find it or fixate on it, that's when I would maybe shake it a little bit. And then you can kind of progress to add more things. In terms of the vibes tool specifically, it's strictly an observational tool. They don't give any specific instructions on how you use it because it is still in the earlier stages of development. I had reached out to the person who made it and was like, am I supposed to be using this a specific way? And they're like, we're not there yet. So it is kind of a tool that you can just kind of implement into kind of the different assessment tasks that you are doing, which I think is nice. Um, and I think hopefully they start to do more assessment and testing with it. And then vibes is not listed when you're talking about school-based assessments. That is true. So this assessment was actually created by a group of ophthalmologists who are specialized in CVI and visual processing for kids. So they created this matrix to look at specific skills. I think an OT or PT, it could be appropriate to use. I think an educator would be appropriate to use. It just would depend on where it's labeled. Use for what it's being used for. I think education, you guys have your specific assessments to look at educational impact. So maybe it wouldn't get used in that setting as much, but I don't think it's inappropriate for an OT or PT to look at the vibes as a way to measure function in the context of looking and reaching, which I think is a very OT, PT appropriate area to look at. But I do think we're going to have to shift over. But if